Welcome back. You know, if you just live long enough, you're going to eventually get at least a few aches and pains, or maybe a lot of them. It's time to try to work them out or do something about it. Joining me from our Auburn Bureau is Dr. Brad Adams of Advantage Chiropractic Clinic. Thanks so much for being here. You're looking good over there in Auburn.
Thank you, Dee. I appreciate it.
Awesome, awesome. We'll jump right in there with the questions. I'll tell you, our Facebook, when they found out you were coming, they hit us with a lot of questions. What are the most common problems that you see in your practice?
We see a lot of different ones that come in, honestly. I wish there was an easier answer for that, Dee, but it's one of the more common problems that we do see is going to be it's arthritis. It's degenerative joint disease. We got some questions last week on your show about this, and it's a pretty common situation. It actually affects about 27 million Americans every year. I mean, it's the leading cause for disability with chronic problems as far as arthritis and things like that go. So it's very, very common. It affects most of us. We've sort of just generalized it as it's part of the aging process. I mean, that's just the way it's going to be. That's not exactly true. There are things you can do to reduce your chances. There are things you can do to limit the severity of the arthritis and
that would be my question. Let's take a look at that. Since it is so common, what are some of the things that we can do to maybe head it off or make it not as bad as it could have been?
Absolutely, and that's not a hard question. We all know the answer to that. The hard part is following through on it. It's a healthy lifestyle. It's exercise, it's healthy diet, fruits and vegetables, low-fat meats, things like that. Just trying to stay as healthy as you can. You've got to be active, you've got to eat right, you've got to manage your stress, you've got to sleep correctly. So it's much easier said than done. We know that. That's one of the things we focus on in our office is really trying to fit these things, these lifestyle changes into your life. I mean, if I tell you, for instance, if you like drinking Coca-Cola, and I tell you you can't have any more Cokes, well, you're probably going to laugh at me on your way to the store as you pick up a 12-pack of Coke. So we have to make it part of what you can get used to. So if that means explaining to you that the dangers that come with some of these different chemicals in the foods we eat and being sedentary and not as active as we should be, then we try to fit that into your lifestyle so there's a better chance of you being compliant, of you actually following through and helping yourself. So that's what it's all about. And the trick for this really is prevention. You've got to take care of yourself ahead of time. But the next question we get is, what do you do once it's there?
Once
if it's too late to prevent it, what do we do about it now?
Once it's there, you know you have arthritis.
Yeah, it's very common. What we try to do with that, the key to that is you got to keep moving. You just got to keep moving. We talked a little bit about that last week of finding ways for you to exercise, whether it be in the pool, whether it be walking, whatever it is that's not. A rule of thumb with arthritis is if it hurts, you need to be careful with that because you're probably just going to make it worse. You're going to irritate it. So you've got you're toeing a thin line. You need to be active. You don't just want to sit on the couch all day because it hurts to do anything. That's just going to make it worse. But if you're too active, you can cause some flare-ups in some other situations where it's very uncomfortable and the soreness and the discomfort sets in.
Like they need to be in touch with their chiropractor before they make a real drastic move. We have some questions on Facebook. Janae, what are they asking?
Yes, this question is actually from Carol of Columbus. She wants to know, at what age do you recommend starting alignments?
At what age do you recommend alignments?
Yeah, and the answer to that very early. Again, it's about prevention. So I don't know if you've if any of our female viewers out there going through childbirth, you understand how traumatic that can be. So as far as chiropractic care is concerned, a lot of chiropractors recommend starting as an infant. I mean, starting at a very early age, because if your body's not starting out right, then it's just going to continue to sort of derail in a sense. So very early is what the answer for that would be.
Very early,
within several months of. Now that's not for everybody. It's a lot of us, we would rather just wait until it's bothering us, and we understand that. So.
Okay, Janae, we have another question?
We do. This one's from Sue. It's about getting adjustments. She says her son has a few herniated discs which are pinching a nerve. Can adjustments relieve that pain? He's only 25 years old.
Ooh, a fairly young guy that has problems with herniated discs. And first you can explain again what that is.
A herniated disc, that's a version, in a sense, of degenerative disc disease, which is close to degenerative joint disease. It's similar. There's different levels as far as stages for how a disc can herniate. There's a bulge, there's prolapse, and there's a lot of different research on the categorizing of these conditions. It's hard to say. We have patients in our office that have benefited from chiropractic adjustments and physical therapy. There's exercises, there's things he needs to be doing to correct these problems. Otherwise, they will just continue to perpetuate and continue to snowball into something more disabling and more uncomfortable for him in the future. So he does need to be seeking treatment with somebody, whether it be physical therapy. I recommend chiropractic care because you can sort of, you get the benefits of both. There is physical therapy involved, which is very necessary, but also if the joints aren't moving correctly, that over time can lead to arthritis or degenerative joint disease.
Wow.
So that's our #1 treatment for that. It's going to be getting the joints working correctly, getting the bones back where they're supposed to be, because as long as they're out of position, for instance, let's talk about your car. If your alignment is off in your car, you can keep replacing your tires all day long, but the alignment is still wrong and it's going to continue to wear out the tires. So we need to kind of get to the root of the problem. In some situations, it may be that his joints are out of place and they're not moving the way they're supposed to, which over time can lead to the disc problems.
And you mentioned when we spoke with you on an earlier show that you are actually in consultation with other doctors who are working on the same patient, so that you work together.
Absolutely, and you need to do that. I mean, as far as being a diligent doctor, you need to understand what other treatments is this patient undergoing, what are their surgical options in the future, what are the other doctors telling them, what's the advice? Because if we're contradicting each other, we're not helping the patient in any way. They're just going home more confused. And that's the problem a lot of our patients come in with. They don't really know what they're supposed to do. They're not sure if they're eating healthy or not. You know, they read one article in the news one day and then they hear about a different one next week. They're not sure if tomatoes help them or kill them. So, I mean, it's hard out there now. And that's really what a doctor is there for, is to help you get through all the muck and figure out what's going to be best for you and what's safe for you.
Okay,
so we really try to work with those other doctors because different treatments can benefit the patient.
We do have our phone lines open at 706-569-9390. Now, in the South, one of the things I would hear about growing up as a child is the powdered medications, pouring it into one of the beverages, a Coca-Cola, as soon as someone had an ache and pain. What do you recommend for someone who's taking a lot of over-the-counter stuff?
Well, you need to talk to your pharmacist, first of all, because most people, by the time you're taking several over-the-counter medications, they're called NSAIDs, actually. It's called non-steroidal anti-inflammatory drugs. It's a broad category of medication that's basically your over-the-counter medication, your Tylenols, your Advils, things like that. And they're not harmless. They do have side effects. I mean, that's one of the leading causes of hospitalization every year is overuse of over-the-counter medication, and we don't talk about that enough with our patients. But the trick is your pharmacist has your records, they know what medication you're taking, and they can point you in the direction of what's going to be best for you. Generally speaking, acetaminophen or Tylenol is the easiest on your system, so that's what we recommend starting out with, and then from there kind of working with what works best for you.
We have someone who called in who doesn't want to go over the air, but they said, can you help them with stress headaches?
With stress headaches, tension headaches. Yeah, absolutely. We have a lot of patients that come in for those problems. Tension headaches or stress headaches are a type of headache. There's several different types of headaches. There's migraines, there's cluster headaches, things like that. But tension headaches are more related to posture, muscle spasms, tension in your neck and in the joints in there. And that actually is a very good lead-in. I'd like to, if we can we pull up one of the slides that we brought? Let's pull up slide 2 at first. And I believe that shows a picture of a lateral picture, a side view of a patient's neck.
Yes.
It's an x-ray. I hope it shows up clearly there. And you can notice that nice curve to it. It's a backward C, pointing back to the back of the neck. That's what you want to see. That's good posture. That's what a curve should look like in the neck. It allows your head to be over your center of gravity, and it doesn't weigh as much. So your muscles aren't being used as often. They're allowed to rest. If we can kind of lead from there into slide 1, I'm going to show you one of the major causes that we see in our office as far as tension headaches. What we're looking at with that one, you'll notice where you have the forward view of that, and the head is actually starting to get out in front of your shoulders a little bit. That curve, that backward C that we like to see in the first one, we've lost that. Now it's tilted forward and it's straightening out. That over time is likely going to degenerate. It's going to lead to some uneven wear and tear in those joints and discs, and can cause some more severe problems later on. But tension headaches basically work. This patient's muscles, their neck muscles, are having to work extra hard to pull their head back over their shoulders. And when your muscles work all the time, they don't get a break, they start to get sore, they start to tear, they start to spasm. That causes a chain reaction which feels like your head's in a vise, those muscles in your head tighten down, and that leads to a tension headache. So I'd venture to say most patients, particularly when calling, have experienced these headaches. They're worse when they're sitting at a computer for an extended period of time, or when they're driving for a ways. These types of things, not to mention stress, where it comes from. When we're stressed out, we tighten up our shoulders. When you tighten your shoulders up like that, those muscles get tight again, and that can start the headaches all over again. So
I had a question from a friend.
We do treat those.
I had a question from a friend also, Dr. Adams, excuse me for interrupting, but she said she wanted to know if the adjustments are painful. Now, I've had adjustments, and I told her, I said, no, actually they feel good. But how would you explain to someone who says, oh, you know, it looks like that might hurt?
I understand, yeah. Well, and it's hard, you know, you're trusting somebody else to move and manipulate your spine, to move your bones. So that can be a little bit disconcerting at the beginning. It can be uncomfortable for a lot of our patients. So we take the time. Most chiropractors are pretty good at this. They take the time to explain to the patient what's going on. And if you're not comfortable, voice that opinion to the chiropractor. Let them know what your concerns are. As far as is it painful or not, I can't say that across the board. Most of our patients, as you mentioned, do enjoy the treatments. They feel better afterwards. But in the beginning, I mean, you're coming in most cases with pain, with soreness. If you're already sore and I start pushing on it, I can't promise that it's not going to be a little bit sensitive. But generally, I hate to use it. I don't use it often. But every once in a while, the no pain, no gain scenario comes into play. And you've got to help this person kind of get through some of that so they can start to get better. I mentioned I compare it a lot to braces for a lot of our patients. You know, braces don't feel good at first, but in the end, they're doing their job. So.
Okay, thank you so much. Always you bring so much good information, and I hope that that encourages people who are listening to take better care of ourselves, because there's so much that we can do to prevent things. Dr. Adams, thanks so much, live from Auburn. He is going to have some information on our website, and you can continue to send in the questions, and he will be back. Thanks so much for being on the D. Armstrong Show, Dr. Adams, and we will be back after this break.